Confidentiality refers to keeping patient information and details private and secure. There is specific GMC guidance on confidentiality which you must be aware of and demonstrate in the Plab2 exam. Patients have a right to have their personal information held in confidence by doctors. Doctors have an ethical and legal responsibility to protect patient information. In the exam, you can assume patient confidentiality. However, you may have to highlight it if the patient has concerns, or breach confidentiality by disclosing information if this is justified. We must consider that information sharing is key to good clinical care. Medical professionals require relevant, up-to-date and accurate patient information, and health services require information on patients to function safely and efficiently. Information sharing is also sometimes necessary for public protection. Important individuals to be aware of within each NHS organisation is the Caldecott Guardian. This is a senior person responsible for protecting confidential information and ensuring that any information sharing is done appropriately. Within the UK, the Data Protection Act and the Human Rights define the legal requirements relating to confidentiality. For the exam, you are not expected to know these in any detail. If you have concerns regarding confidentiality in the law, you can describe to the examiner you would refer to your medical defence union and your local Caldecott Guardian. The GMC recommends some core principles relating to confidentiality. They highlight you should use the minimum necessary information for disclosure and manage and protect all patient information. As a doctor, you must know your responsibilities and comply with the law. You can share relevant information for direct care, but you should routinely ask for consent from the patient or tell them about information disclosures. Lastly, doctors should support patients to assess their information. Confidentiality is assumed in every doctor-patient scenario. However, there may be times when you are required to breach confidentiality and disclose patient information. You can do this if the patient consents or if the disclosure is of benefit to the patient who does not have the capacity to consent. You may also be required by law to disclose information or if it is justified in the public interest. If the patients provide their consent and have full understanding of the disclosure, you are allowed to disclose their information. If a patient lacks capacity, you should work within the confines of the Mental Capacity Act when considering any information disclosures. The care of the patient should be your primary concern, and the patient should be involved as far as they are able. There are some scenarios when doctors are required by law to disclose information. These include notification of serious infectious disease, for the provision of health and social care services, prevention of terrorism, or if instructed by the courts. In the Plab2 exam, you should highlight to the examiner you would seek senior advice and advice from your hospital legal team. There is also a requirement for doctors to disclose information if it is in the public interest. The public interest is defined as the benefits to an individual or society outweigh both the public and patient's interest in keeping the information confidential. Examples of this include informing a public health department of a serious infectious disease that poses a risk to the public, informing the police to prevent, detect or prosecute serious crime, to protect at-risk individuals or groups, for example children at risk from domestic violence, and to those who pose a risk to themselves or the public if they are unfit to drive. Doctors have a legal and ethical responsibility to protect patient information. Appropriate information sharing is an important aspect of patient care. In the Plab2 exam, you should ask the patient for their consent before disclosing information. Be aware of situations when you can breach confidentiality, such as those required by law or justified in the public interest. In the exam, highlight to the examiner that you know where to seek assistance, such as from the Caldecott Guardian, hospital legal team, or medical defence union. The latest GMC guidelines on confidentiality can be found here.